Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. Look around and it's not hard to notice the surge in plastic surgery. From magazine covers to the popularity of shows like Nip Tuck, plastic surgery is everywhere and has become one of the most common medical treatments out there. But there's also the other side of plastic surgery, the mistakes and the horror stories. Here to help you avoid them and make the right choice when considering plastic surgery is Dr. Francisco Colon. He is a plastic surgeon with the Pure Group in Florham Park. Dr. Colon, welcome to the program and thank you for joining us.
Thank you for having me.
So, has America gone crazy? I mean, this Heidi Montag who's had 10 procedures in one day, is that realistic, or has America just gone crazy?
I cannot make any comments about Heidi Montag. I know nothing about her. But I think patients who are researching plastic surgery need to make sure they're doing it for the right reason. They need to make sure they're working with professionals, make sure that they understand what they're getting themselves into.
What are the right reasons? I mean, why should people have these procedures?
Well, cosmetic surgery is not a surgery that you could say, from the traditional terms, it's not surgery that you may need, even though some, for example, actors may use it, may need that kind of surgery. It's surgery that you want. And you have to decide. So
these are elective procedures?
It's elective procedures that you do it, but why do you want that surgery? You have to be sure you're doing it for the right reason. It is surgery that you're doing for yourself. Is it something that will make you feel good about yourself? Is it something that's going to improve the quality of your life? That's what we as plastic surgeons like to see in our patients. What we're doing, are we improving the quality of the life for that patient? So
somebody is going to have plastic surgery. What do they need to consider? And we have some tips that people need to look at. And the first one is obviously, you really need to do your research.
Oh, absolutely. In the age of the internet, there's so much information out there. You can find out a lot about your surgeon, a lot about your procedure, a lot about the options available to you before you have any surgery, before you go into a consultation. I like to see my patients come in with all this information and load it up with questions, and that's what we want to see. We want patients well educated.
Right, exactly. And that's across the board with I think anything to do with medicine. Our next tip is, you really need to have realistic expectations, excuse me.
Absolutely, and that's part of it. You have to know that surgery is surgery. It is not a trip to the spa. There is recovery that goes with it. You have to discuss with your plastic surgeon, how much time do I need to recover from this? What is realistic? And also be very specific. What are you doing to my face? What are you doing? Be specific. Look at your picture with your plastic surgeons and be very specific about what you want done, and even more important, what you don't want to do.
Right, very good point. The next one is be knowledgeable. Be knowledgeable about the procedure?
Be knowledgeable about the procedure. Be knowledgeable about the surgeon who you're meeting, who is your surgeon. Make sure you ask questions. Come in with a list of questions. Ask. Don't be afraid to see multiple plastic surgeons. In this day and age, most patients I see have already seen 2 or 3 plastic surgeons before they come see me.
And that really is our next tip, is ask questions, because if you don't ask, you won't know. And I really like what you just said about the idea of be specific about what you want, but be specific about what you don't want also. And I think that's a very important piece. And then what about choosing the right surgeon? There are certain qualifications and credentials that people need to have.
It's very confusing now because there are so many terms being thrown around. Who's a cosmetic surgeon? Who's a facial plastic? Who's a plastic surgeon? I'm a plastic surgeon. Of course, I'm biased. Plastic surgeons go through a specific training. They dedicate anywhere between 6 to 8 years of their lives after medical school to learn the science and the art of plastic surgery. That's a very well-trained individual. That's an individual who is dedicated to servicing these patients. It's an individual who's passed certain boards. And you have to know, when you go and interview a plastic surgeon, ask, are you a plastic surgeon or are you a cosmetic surgeon? And what does that mean, a cosmetic? How much time did you really spend
What is the
studying?
difference between the two? What's the difference between a plastic surgeon and a cosmetic surgeon?
Well, you have to be specific. There are surgeons who are, or there are doctors who are dermatologists who may do a year of cosmetic surgery or more, and you should be knowledgeable. You should know what that doctor's training is all about. Ask the questions, look at their resume, their CV,
Right.
and know a plastic surgeon certified by the American Board of Plastic Surgery is a surgeon who, after medical school, has usually spent about 3 years with general surgery, sometimes 5 years of general surgery,
Right.
and at least 2 to 3 years dedicated to plastic surgery, and even more. So you're talking about individuals, again, who are very well trained and refined in the art of plastic
And
surgery.
I'll tell you, this is something that I tell my patients all the time. You don't want to go to somebody that took a couple of weekend courses.
Correct.
And that is a mistake that I think a lot of people get into. Is there anybody that, have you ever turned people away?
Absolutely.
And why would you turn them away?
You know, you have to look at patients. We were talking about before, doing things for the right reason, and making sure that people are in the right frame of mind, that psychologically they're stable. There are many, not only medical, but psychological reasons that may affect that decision.
That is a very good point. The psychology involved in going through a procedure, doing it for the right reason. What's the youngest person you've ever done a procedure on?
Well,
let me better. The oldest. How about the oldest? Real quick. Give me an age.
Quickly, 85.
85.
I mean, you know, it's different. People are aging so well these days. An 85-year-old now could be as healthy as a 60 or 55-year-old 30 years ago. So we're seeing a total different generation.
Thank you so much for joining us. It's been a pleasure to have you with us here today.
To be here.
When we come back, I'll answer